Hello guys, and welcome to this video to learn about furcation exposure or furcation lesions. Okay, so let's talk about this type of lesion. Actually, there are many approaches described in the literature to deal with these lesions, but according to most of the books of oral surgery, this is considered one of the criteria for extractions. Okay, the extraction of this tooth, for example, is also an accepted approach to treat this case, right? So let's understand why, and let's understand how to diagnose this case. Okay, here let's start actually talking about this calculus that we have here. So we have periodontal vertical bone defect here, okay, and then there is even periodontal ligament space widening on the mesial root of this first molar, right? We have a failing endodontic treatment, but then, of course, we have the furcation exposure, right? So we have this bone loss here leading to furcation exposure. And now take a look at this because this is very important. That's how it happens usually. We have even the horizontal bone loss, so the loss of the level of the alveolar crest here as well, right? Buccal and lingual. So this is also something compromising the prognosis of this tooth, okay? And there's even a failure in the buccal bone, okay? So usually, if this leads to an acute infection, then we would have the fistula draining through the buccal gingiva or sometimes even draining through the periodontal pocket. And this would be, of course, a periodontal abscess, okay? This was even commented in the two videos before this one, so the video of dental fistula and the video of root fractures, okay? So if you guys want, please go to these videos to review those concepts because it's really important, all right? And then there is also nice articles like this one, for example, mentioned in this screen, saying that CBCT is beneficial for the patient to diagnose this type of condition, so periodontal issues like this, and especially to plan treatments, for example, like an open flap debridement or a grafting surgery. So of course you could try something a little bit more conservative. If the patient is elderly, we want to avoid the extraction, or the patient is undergoing a chemotherapy, for example, and then of course the extraction could lead of course to osteonecrosis. And depending on the case, we could of course try a more conservative approach to avoid the extraction. But it depends on the case, right? So if we have an acute infection, for example, if you have an uncontrolled situation, then we need to do something about this, right? So of course, that's why each case should be considered on an individual basis in regard to which is the best treatment, okay? So, but we should be careful with cases like this, especially if we have a systemically compromised patient, okay? So those were the key points of today. If you guys liked, please hit the like button and see you guys on the next videos.